Would you like free audiobooks? Click the link in the description. Question 1. A patient presents with acute otitis media. Which of the following findings would the nurse expect upon assessment? A. Low-grade fever and lethargy. B. Sharp, stabbing ear pain with hearing loss. C. Bulging and red tympanic membrane. D. Dry cough and rhinorrhea. Correct answer. C. Bulging and red tympanic membrane. Rationale: acute otitis media is characterized by the presence of fluid in the middle ear, along with signs of infection such as a bulging and red tympanic membrane. Options A, B, and D may be seen in various conditions, but the bulging and red tympanic membrane is most indicative of acute otitis media. Question 2. When educating a patient on the use of a hearing aid, which of the following points should the nurse emphasize for preventing earwax buildup? A. Clean the ear mold with a dry, soft cloth daily. B. Use cotton swabs to clean inside the ear canal. C. Insert the hearing aid as deeply as possible into the ear canal. D. Avoid using the hearing aid during exercise. Correct answer. A. Clean the ear mold with a dry, soft cloth daily. Rationale: to prevent earwax buildup, it's essential to maintain the hearing aid properly, which includes cleaning the ear mold daily with a dry, soft cloth. Using cotton swabs in the ear canal can push wax deeper and cause impaction. Inserting the hearing aid too deeply can damage the ear canal, and avoiding use during exercise isn't directly related to preventing wax buildup. Question 3. A patient with a history of chronic sinusitis reports experiencing facial pain, nasal congestion, and a reduced sense of smell. Which of the following interventions should the nurse suggest first? A. Start a course of oral antibiotics. B. Use a nasal saline irrigation twice a day. C. Undergo endoscopic sinus surgery. D. Take oral decongestants regularly. Correct answer. B. Use a nasal saline irrigation twice a day. Rationale: for chronic sinusitis, initial management focuses on symptom relief and promoting sinus drainage. Nasal saline irrigation can help clear nasal passages, reduce congestion, and facilitate drainage. Antibiotics are not first line unless a bacterial infection is confirmed. Surgery is considered when conservative treatments fail. Oral decongestants may help, but can cause rebound congestion if used for too long. Question 4. A 4-year-old child is diagnosed with epiglottitis. What is the priority nursing intervention? A. Administer a broad-spectrum antibiotic. B. Prepare for immediate intubation. C. Encourage oral fluid intake. D. Perform throat cultures. Correct answer. B. Prepare for immediate intubation. Rationale: epiglottitis is a medical emergency that can rapidly progress to airway obstruction. The priority is to ensure a patent airway, which may require immediate intubation. Antibiotics are essential, but secondary to airway management. Throat cultures and encouraging fluids are inappropriate at this stage due to the risk of triggering complete airway obstruction. Question 5. A patient with allergic rhinitis reports severe nasal itching and frequent sneezing. Which of the following medications should the nurse anticipate administering? A. Oral corticosteroids. B. Intranasal antihistamines. C. Systemic decongestants. D. Antibiotics. Correct answer. B. Intranasal antihistamines. Rationale: intranasal antihistamines are effective for relieving nasal itching, sneezing, and rhinorrhea associated with allergic rhinitis. Oral corticosteroids are used for severe cases. Systemic decongestants may relieve congestion but not itching or sneezing. Antibiotics are not indicated as allergic rhinitis is not caused by a bacterial infection. Question 6. During a health history interview, a patient mentions experiencing vertigo, especially when rolling over in bed. The nurse recognizes these symptoms as consistent with A. Meniere's disease. B. Benign paroxysmal positional vertigo, BPPV. C. Acoustic neuroma. D. Otitis media. Correct answer, B. Benign paroxysmal positional vertigo, BPPV. Rationale: BPPV is characterized by brief episodes of vertigo related to changes in head position, such as rolling over in bed. Meniere's disease involves more prolonged vertigo attacks, hearing loss, and tinnitus. Acoustic neuroma may cause hearing loss and balance problems, but not typically vertigo triggered by position changes. Otitis media presents with ear pain and possible hearing loss, but not vertigo. Question 7. A patient presents to the clinic complaining of a sore throat, fever, and swollen lymph nodes. Upon examination, the nurse notes white patches on the tonsils. The most likely diagnosis is A. Laryngitis. B. Pharyngitis. C. Tonsillitis. D. Epiglottitis. Correct answer: C. Tonsillitis. Rationale: tonsillitis is characterized by inflammation of the tonsils, often with the presence of white patches or spots, exudate, sore throat, fever, and swollen lymph nodes. Pharyngitis may also present with a sore throat but without the characteristic white patches on the tonsils. Laryngitis involves voice changes, such as hoarseness, and epiglottitis is a severe condition marked by fever, difficulty swallowing, and potential for airway blockage, but not typically white patches on the tonsils. Question 8. For a patient diagnosed with Meniere's disease, which of the following dietary modifications should the nurse recommend to help manage symptoms? A. Increase protein intake. B. Reduce sodium intake. C. Eliminate caffeine. D. Both B and C are correct. Correct answer: D. Both B and C are correct. Rationale: dietary modifications for Meniere's disease include reducing sodium intake to help manage fluid retention, which can affect inner ear pressure, and eliminating caffeine, which can stimulate the inner ear and exacerbate symptoms. Increasing protein intake is not directly related to managing Meniere's disease symptoms. Question 9. A nurse is caring for a patient who has just undergone a tonsillectomy. Which of the following symptoms would require immediate intervention? A. Sore throat. B. Mild nausea. C. Frequent swallowing. D. Low-grade fever. Correct answer: C. Frequent swallowing. Rationale: frequent swallowing post-tonsillectomy may indicate bleeding from the surgical site, a potential post-operative complication that requires immediate intervention to prevent significant blood loss. A sore throat, mild nausea, and low-grade fever are common post-operative symptoms that, while important to manage, do not typically require urgent intervention. Question 10. When providing discharge instructions to a patient who has undergone nasal polyp removal surgery, what should the nurse include to prevent complications? A. Advise strenuous exercise to improve nasal airflow. B. Instruct on the avoidance of nasal blowing for a specified period. C. Recommend the use of over-the-counter nasal decongestant sprays. D. Encourage frequent nasal irrigation starting the day of surgery. Correct answer: B. Instruct on the avoidance of nasal blowing for a specified period. Rationale: after nasal polyp removal, it's important to prevent any actions that increase nasal pressure, such as blowing the nose, which can disrupt the healing process or cause bleeding. Strenuous exercise should be avoided initially. Over-the-counter nasal decongestant sprays can lead to rebound congestion if used long-term, and nasal irrigation might be recommended but typically not immediately following surgery. Question 11. A patient diagnosed with a vestibular schwannoma reports a gradual loss of hearing in one ear, tinnitus, and balance problems. What is the priority nursing action? A. Advise immediate cessation of all physical activity. B. Schedule the patient for emergency surgery. C. Provide patient education on the disease and its potential impact. D. Initiate a high-dose corticosteroid regimen. Correct answer. C. Provide patient education on the disease and its potential impact. Rationale: for a patient with a vestibular schwannoma, also known as an acoustic neuroma, it is crucial to educate them about the condition, its symptoms, and potential impacts on daily life, including options for management and treatment. Emergency surgery, cessation of all physical activities, or initiating high-dose corticosteroids are not immediate priorities without further assessment and recommendations from a healthcare provider specializing in this condition. Question 12. A nurse is assessing a child with suspected acute otitis externa, AOE. Which of the following symptoms would be most indicative of AOE? A. Ear pain that worsens with movement of the outer ear. B. High fever and severe headache. C. Fluid drainage from the middle ear. D. Loss of hearing and tinnitus. Correct answer. A. Ear pain that worsens with movement of the outer ear. Rationale: acute otitis externa, often referred to as swimmer's ear, is characterized by inflammation of the ear canal, leading to symptoms like ear pain that intensifies when the outer ear or tragus is moved. High fever and severe headache are more indicative of systemic infections. Fluid drainage from the middle ear suggests otitis media, not externa. Hearing loss and tinnitus could be symptoms of various ear disorders, but are not specific to AOE. Question 13. A patient presents with a perforated eardrum following a middle ear infection. Which of the following actions should the nurse prioritize? A. Instruct the patient to avoid getting water in the ear. B. Begin a high-dose antibiotic therapy immediately. C. Recommend the use of over-the-counter ear drops for pain. D. Prepare the patient for surgical repair of the eardrum. Correct answer. A. Instruct the patient to avoid getting water in the ear. Rationale: preventing water from entering the ear is crucial in the case of a perforated eardrum to avoid infection or further injury. While antibiotics may be necessary if infection is present or persists, they are not the immediate action. Over-the-counter ear drops should be avoided unless specifically recommended by a healthcare provider, as some products may be harmful to an open eardrum. Surgical repair is considered for perforations that do not heal naturally but is not an immediate action. Question 14. Which of the following statements by a patient who recently underwent a laryngectomy indicates the need for further teaching? A. I should use a humidifier at home to keep the air moist. B. I can no longer swim, but showers are still okay. C. I will learn to use alternative speech methods. D. It's safe for me to smoke as long as I use a filter. Correct answer. D. It's safe for me to smoke as long as I use a filter. Rationale: smoking is contraindicated for patients who have undergone a laryngectomy due to the risk of cancer recurrence and its negative impact on overall health. The use of a filter does not mitigate these risks. The other statements reflect appropriate understanding of postoperative care and adjustments. Question 15. A patient with chronic rhinosinusitis is not responding to conservative treatment measures. The nurse knows that the next step in management may include: A. Cognitive behavioral therapy. B. Increased doses of intranasal corticosteroids. C. Endoscopic sinus surgery. D. Initiation of antifungal therapy. Correct answer: C. Endoscopic sinus surgery. Rationale: for patients with chronic rhinosinusitis who do not respond to conservative treatments, such as nasal corticosteroids, saline irrigations, and antibiotics if indicated. Endoscopic sinus surgery may be considered to improve sinus drainage and address underlying anatomical contributors to their condition. Cognitive behavioral therapy is not a standard treatment for rhinosinusitis. Increasing doses of intranasal corticosteroids beyond recommended levels may lead to side effects without improving outcomes. Antifungal therapy is not typically used unless a fungal infection has been specifically identified. Question 16. A nurse is educating a group of parents about preventing otitis media in children. Which of the following should the nurse include as a preventive measure? A. Encouraging bottle feeding in a lying down position. B. Administering prophylactic antibiotics during cold season. C. Avoiding exposure to tobacco smoke. D. Using antihistamines regularly during allergy season. Correct answer. C. Avoiding exposure to tobacco smoke. Rationale: exposure to tobacco smoke has been associated with an increased risk of otitis media in children. Avoiding smoke exposure can help reduce this risk. Bottle feeding in a lying down position can actually increase the risk of otitis media. Prophylactic antibiotics are not generally recommended due to the risk of antibiotic resistance. Regular use of antihistamines during allergy season without specific indications can lead to unnecessary medication exposure and is not a proven preventive measure for otitis media. Question 17. A patient presents with a history of sudden, unilateral hearing loss without preceding illness. What is the nurse's best first action? A. Advise over-the-counter decongestants. B. Prepare to administer high-dose corticosteroids. C. Schedule an immediate audiometric evaluation. D. Recommend ototoxic medications to improve symptoms. Correct answer. C. Schedule an immediate audiometric evaluation. Rationale: sudden, unilateral hearing loss without a clear cause warrants prompt evaluation, starting with an audiometric test to assess the extent and type of hearing loss. This could be a sign of sudden sensorineural hearing loss, which may require urgent treatment. Over-the-counter decongestants and ototoxic medications are not indicated without a diagnosis, and while corticosteroids may be part of the treatment plan, they should only be administered after a thorough evaluation. Question 18. Which of the following is an essential component of discharge education for a patient who had a septoplasty? A. Resume normal activities and exercise immediately to promote healing. B. Nasal packing can be removed at home 24 hours post-operation. C. Avoid blowing your nose for the recommended period to allow proper healing. D. It's expected to lose the sense of smell permanently after surgery. Correct answer. C. Avoid blowing your nose for the recommended period to allow proper healing. Rationale: after a septoplasty, it's important to avoid activities that can disrupt the healing process, such as blowing the nose, which can increase the risk of bleeding and disrupt the surgical site. Resuming normal activities and exercise should be gradual and as advised by the healthcare provider. Nasal packing, if used, should be removed by a healthcare professional, not the patient, to prevent injury. Loss of the sense of smell is not a common outcome and should not be expected as permanent post-septoplasty. Question 19. A patient diagnosed with vestibular neuritis is experiencing severe vertigo. Which of the following interventions should the nurse prioritize? A. Encouraging rapid head movements to recalibrate vestibular function. B. Administration of oral corticosteroids and antiemetics. C. Immediate referral for vestibular rehabilitation therapy. D. Advising strict bed rest until symptoms resolve. Correct answer. B. Administration of oral corticosteroids and antiemetics. Rationale: for acute vestibular neuritis, initial management focuses on reducing symptoms and inflammation. This includes the administration of oral corticosteroids to reduce inflammation and antiemetics to manage nausea and vomiting associated with vertigo. Rapid head movements can worsen symptoms initially and are not recommended. Vestibular rehabilitation therapy may be helpful in the recovery phase, not immediately. While some rest is advised, strict bed rest is not necessary and can delay recovery of vestibular function. Question 20. In educating a patient about managing tinnitus, which of the following suggestions should the nurse include? A. Increase caffeine and nicotine intake to improve alertness. B. Use white noise machines or fans at night to mask the tinnitus. C. Avoid all forms of exercise that can exacerbate symptoms. D. Listen to music at maximum volume through headphones to drown out tinnitus. Correct answer. B. Use white noise machines or fans at night to mask the tinnitus. Rationale: using white noise machines or fans can help mask the internal sounds of tinnitus, making it less noticeable and aiding in relaxation and sleep. Increasing caffeine and nicotine intake can actually worsen tinnitus for some individuals. Moderate exercise is generally beneficial for overall health and can help manage stress, which may exacerbate tinnitus symptoms. Listening to music at high volumes, especially through headphones, is discouraged as it can further damage hearing. Question 21. A nurse is conducting a health promotion seminar on preventing external otitis. Which of the following recommendations is most effective? A. Dry ears thoroughly after swimming or showering. B. Insert cotton swabs deep into the ear canal to remove water. C. Use olive oil drops nightly to keep the ear canal lubricated. D. Avoid wearing earplugs or hearing aids to reduce mechanical irritation. Correct answer. A. Dry ears thoroughly after swimming or showering. Rationale: drying ears thoroughly after exposure to water is crucial in preventing external otitis, commonly known as swimmer's ear, by not allowing moisture to remain in the ear canal, which can promote bacterial growth. Inserting cotton swabs can push debris further into the ear canal and cause injury. While some ear drops may help maintain ear health, olive oil drops nightly without specific indication could contribute to buildup. Earplugs and hearing aids should be used as needed but kept clean to prevent infection. Question 22. A patient with a confirmed diagnosis of pharyngitis caused by group A streptococcus is most at risk for developing which of the following complications if untreated? A. Viral pneumonia. B. Rheumatic fever. C. Otitis external. D. Epiglottitis. Correct answer. B. Rheumatic fever. Rationale: untreated or inadequately treated pharyngitis caused by group A streptococcus can lead to rheumatic fever, a serious condition that can affect the heart, joints, nervous system, and skin. Viral pneumonia is not directly linked to streptococcal pharyngitis. Otitis externa and epiglottitis are not complications of untreated group A streptococcal pharyngitis. Question 23. What is the priority nursing action for a patient experiencing an acute attack of Meniere's disease? A. Encourage the patient to perform vigorous head movements to decrease vertigo. B. Provide a quiet, dark environment and assist with position changes. C. Administer high-dose loop diuretics immediately. D. Instruct the patient to increase salt intake to manage symptoms. Correct answer. B. Provide a quiet, dark environment and assist with position changes. Rationale: during an acute attack of Meniere's disease, providing a quiet, dark environment can help reduce stimuli that may worsen vertigo and nausea. Assisting with gentle, slow position changes can help manage vertigo safely. Vigorous head movements, high-dose loop diuretics without specific indication, and increased salt intake are not appropriate interventions for acute attacks of Meniere's disease. Question 24. A nurse is teaching a patient how to manage postoperative care at home after a rhinoplasty. Which instruction is most important? A. You should expect and prepare for permanent changes in your sense of smell. B. Keep your head elevated, even during sleep, to reduce swelling. C. Apply warm compresses to the nose to speed up healing. D. Nose blowing is safe after the first 24 hours post-operation. Correct answer. B. Keep your head elevated, even during sleep, to reduce swelling. Rationale: keeping the head elevated post-rhinoplasty is crucial to minimize swelling and promote proper healing. Permanent changes in the sense of smell are not a common outcome and should not be expected. Warm compresses are generally not recommended immediately post-operatively to avoid increasing swelling or bleeding. Nose blowing should be avoided for a period specified by the surgeon to prevent disruption of the healing tissues and potential bleeding. Question 25. For a patient with laryngopharyngeal reflux, LPR, which of the following dietary modifications should the nurse recommend? A. Increase caffeine and alcohol consumption to stimulate digestion. B. Avoid eating late at night and lying down immediately after meals. C. Consume large meals to decrease stomach acid production. D. Eliminate all fruits and vegetables from the diet to reduce acid intake. Correct answer: B. Avoid eating late at night and lying down immediately after meals. Rationale: for patients with laryngopharyngeal reflux, it's important to avoid behaviors that can exacerbate symptoms. Eating late at night or lying down immediately after meals can increase the risk of acid reflux into the throat, worsening symptoms. Caffeine and alcohol can relax the lower esophageal sphincter and increase reflux. Consuming large meals can actually increase stomach acid production. Eliminating all fruits and vegetables is not recommended as they are essential components of a healthy diet. However, certain acidic fruits might need to be avoided or limited. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.